Good morning, Ms. Hodjat, Shamami.
Good morning.
I'm Dr. Taleb. I'll be your ophthalmologist today, so it's nice to meet you.
Nice to meet you too.
Perfect. Before we start with anamnesis, can we confirm some details with you?
Yes, sure.
Perfect. What's your full name?
My full name is Mahsa Hodjat Shamami.
And what's your date of birth?
It's 6th of January 84, so I'm 40 years old.
Okay, thank you. And what do you do for a living, Ms. Hodjat Shamami?
Well, I'm a freelance graphic designer, so mostly I do digital work in front of a computer.
Okay, what brings you in today?
Okay, so a couple of weeks ago, I started getting this dull ache around my left eye, or behind my left eye, I would even say.
Yes.
And at first I thought it's just from being tired and fatigueness, but it has been getting worse, and there's also some sinus pressure, and there's also swelling, which I noticed.
Okay. And when exactly did you notice the first pain? Was it sudden or was it built up gradually?
I would say it's been gradually, and maybe about 2 weeks ago, I would even say. At first it was just really mild, and now it's almost like an eye strain.
And where exactly is the pain? Is it just behind the eye or does it radiate to the other one?
Mostly behind the eye, but sometimes it spreads towards my temple and also my cheekbones.
And would you describe the pain as sharp, throbbing, pressure-like, or like a burning sensation?
I would say more like pressure, and it feels like something's pushing from behind the eye.
Okay, so is the pain constant or is it come and going?
It's constant now. Worse when I move the eye though.
So on a scale from 1 to 10, how much do you will consider your pain?
I would say a decent 4 most of the time, but it rises to 6 or 7 when I move my eye or try to move it.
Have you noticed any change in your vision?
Yes, there's also some blurriness sometimes, and it feels like there's a haze or a film in front of my eye, so it's not all the time, but definitely more in the evenings.
And do you have blurriness on the left eye, right?
Just the left eye.
Any changes in color perception? Do things look duller than usual?
Now that you mention it, colors do seem a little muted on that side. Yes,
Any double vision?
No, no double vision.
Any pain when looking at bright lights?
Yes, a bit, especially when I go out, so the light has some kind of effect on it.
Yes. Have you noticed any redness or swelling?
Both. There's redness. It's been watering more than usual, not painfully, but just enough to be normal.
Alright, I'm going to ask a few questions about your health history. Do you have any chronic diseases?
Yes, I have Hashimoto's disease. It's been diagnosed about 3 years ago, but I've been taking my medication, so my levels are stable.
And do you have any other chronic conditions like joint issues or family history of the eye?
No.
Any joint pain, chronic sinus issues or jaw discomfort?
No.
Thanks, I'd like to do a full exam now. Check your vision, eye pressure, how the eyes move, and take a close look at the tissue around the eye. Let me know if anything feels uncomfortable. Perfect. So we start with some eye movements. Try to follow my finger. Perfect. Upside, downside. Close and open your eyes. Perfect. So I'm going to palpate your eyes a little. If it gets slightly discomfortable, tell me, okay? Which eye do you think hurts more?
The left, definitely.
Left one. So do you feel any tingles, pain?
Yes, pain.
Okay, perfect. So we're going outside to the other machines to try to see your pressure in the eye and other quick tests. So if you would like, you can follow me. Alright, Ms. Hodjat Shamami, based on your symptoms and what I'm seeing today, I believe you're dealing with something called an orbital pseudotrauma or idiopathic orbital inflammation. So don't be scared. It doesn't mean...
Is it an eye tumor?
No. The word pseudotrauma means it acts like a tumor in terms of swelling and pressure, but it's not cancer. It is an inflammatory condition where the tissues around and behind your eye become swollen, usually linked to autoimmune system activity, and in most cases it's treatable.
And what causes it?
So we actually really don't quite know, but with your history of Hashimoto's, an autoimmune cause is likely. Inflammation flares up without infection or injury, and that's what's caused the pain and swelling of your eyes.
And what do we do next?
So first of all, I'd like to order an MRI with contrast of the orbit to get a clear image of the tissue and confirm the diagnosis. We also do some blood tests, thyroid function and inflammatory markers, and a few autoimmune screens.
And will we start with the treatment right away?
So if your symptoms worsen before the results come in, we may consider starting a short course of corticosteroids, which are very effective in reducing the inflammation. But I prefer to wait until we rule out other causes like infection or, in rare cases, lymphoma before starting the treatment.
Okay, that makes sense.
So in the meantime, if you notice in your vision changing suddenly, more severe pain or increased bulging, please contact us or go to the ER. Otherwise, we move ahead with the test and I follow up with you once we have everything back.
Okay, thank you so much.